Okay, scanning the room.
Hi, my name is Jocelyn Evernon. I'm an AD student at Williston State College, and today for my skills, I'm going to be reconstituting morphine for an IV push and adding medications to a IV solution bag. So to begin, I'm in my med room and I'm going to review my healthcare provider's orders and check it to the mark. So this is for Shirley Coast. Her date of birth is 4/3/1987. It looks like he ordered 250 milliliter bag of normal saline, and to be added is 20 milliliter equivalents of potassium chloride. So I know 10 milliliters, I did my dimensional analysis, as well as morphine sulfate, 4 milligrams IV push, every 2 hours PRN for pain. I have already gone in and talked to my client. I know she's in excruciating pain, so I'm gonna go ahead and get all of this ready. And I did my dimensional analysis, and I know that I need to reconstitute this morphine with 1 milliliter of normal saline. So that is going to come out to a total of 1.4 milliliters to be IV pushed. So I'm going to begin by performing hand hygiene and applying gloves. I'm dealing with high alert medication, so I know I need to be wearing gloves while drawing these up. And I'm going to go ahead and pull my medications out of the Pyxis. So first, I have a bottle of morphine here. It is not expired. It is a morphine 10 milligrams per milliliter, so I know that is correct. And I'm going to go ahead and pull out my potassium as well. Potassium chloride, 20 milli equivalents, and this is correct as well. So that is my second medication check. I'm going to go ahead and get these meds ready now. I'm going to get a clean syringe and needle. I have that ready. I'm going to go ahead and take the cap off of my morphine so I can cleanse the hub. Go ahead and let that dry. Next, I'm going to uncap my needle and draw up 0.4 milliliters of air to inject into my bottle of morphine. I'm going to draw up a little extra so I can get rid of the air bubble that I have. Perfect. Have my second nurse verify the dose.
Looks good.
And then I'm going to prepare my syringe of normal saline here, getting rid of that air bubble. And I'm going to draw up a full milliliter of this for a total of 1.4 milliliters. Going to have a second nurse verify my full dose of 1.4 mils.
Looks good.
And I'm going to scoop to recap, securing at the base, and I'm going to label this syringe. The name of the medication, the dosage, as well as my name. I'm going to set that to the side with the bottle of morphine to check that at the bedside. So next, I'm ready to draw up my potassium. So this is a unopened syringe here with a new needle. And I know that I need to draw up 10 mils of air first to inject into the bottle of potassium. Going to invert Once again, drawing up a little bit extra to get rid of any air bubbles. I'm gonna go ahead and have a second nurse verify the dose of potassium,
Looks
10
good.
milliliters. I'm going to recap so I can open my bag of IV solution. The bag is not open, it's unexpired. The color of the IV solution is good, there's nothing floating in it. I can put light pressure and there's no leaks. So I'm gonna go ahead and label this with my label of my client's name, Shirley Coast, same date of birth, 4/3 of 1987, as well as what I'm adding to the bag, which is 10 mils of potassium. Go ahead and make sure that is on there. Going to cleanse the hub on my IV solution. Let that dry. Going to uncap my potassium and inject that straight in. This goes into the Sharps container. And I'm going to mix this solution side to side lightly without creating any air bubbles. And I'm going to gather the rest of my supplies and head to my client's room. I would put fresh gloves on as I'd entered my client's room. Hi Shirley, I'm back with your pain medication. Can you just go ahead and tell me your full name and date of birth one more time? Shirley Coast, 4/3/1987. I'm noting her codeine allergy from the healthcare provider's orders to her band. We are not doing anything with codeine today, so we are safe to proceed. Okay, I'm going to begin with my IV push of morphine. I know my client's in pain, so I want to go ahead and get that in her as quick as possible. I know I need to cleanse the hub of the saline lock and flush before I push any morphine. I'm going to use an alcohol swab with that. Prep my syringe of normal saline, get rid of that air bubble, as well as make sure that the saline lock is unclamped. I'm flushing to confirm patency, and there is no infiltration. My client is not complaining of any pain, so I'm good to go there. I'm going to do my third med check and scan my medications into the MAR, and that was completed. I'm gonna once again verify 1.4 milliliters of morphine, and that is correct. So I'm going to dispose of the needle in the Sharps container. Connect this to the hub of my client's saline lock. And I know that morphine needs to be pushed very slowly, in this case over the course of 2 full minutes. And for the sake of the video, it has been 2 full minutes. I'm going to dispose of my morphine as well as flush again. Cleanse the hub just to be sure. Get rid of the air bubble. And I'm going to go ahead and flush to prepare for the IV bag with potassium. All done with this. I'm going to go ahead and lock this while I prepare my tubing for the normal saline with potassium. So this bag has been unopened, it is unexpired. I'm going to begin by making sure my cassette is closed. And this end is sterile, so make sure that it is not touching anything. I'm going to take the cap off of my spike and take the cap off of my bag of solution and spike my bag. Okay, I'm gonna go ahead and hang my solution, make sure that this is half full. Then I'm gonna go ahead and open my cassette and prime my tubing. Okay, making sure that there are no air bubbles, and I have return at the bottom of my IV line. Then I'm going to close the cassette, put it in my IV pump. This never wants to go for me. Okay, for the sake of my video, that is in there. I'm going to make sure it's secure by pulling this down, and I'm gonna go ahead and initiate the IV therapy. Once again, cleansing the hub, keeping this sterile while I do so. Making sure that it is not locked. There. I'm going to label my IV tubing next and make sure to set the pump at the prescribed rate. And I would leave the client's room, clean up after myself, change my gloves. Now the IV therapy has been completed, so I'm going to re-enter, perform hand hygiene, put on some fresh gloves, let my client know that the bag of solution is done infusing, so we're going to go ahead and discontinue it. So I'm going to begin by closing the port on my saline lock. I know that this was kept sterile, so I don't need to swab the hub, but I am going to flush, so I'm not going to lock that first. I'm going to get my syringe of saline ready, and my cap for the end of the IV solution, or the IV line, to keep that sterile. Putting this directly on the cap here, so that is kept sterile. Here, turn my pump off, and then I'm going to go ahead and flush. That looks great. Done with that. And go ahead and lock the saline lock on my client's arm and let her know that we're keeping that in just in case she does have pain from the time that she's still here to the time she goes home. So we have somewhere to give that to her. I would make sure to document everything I've done today, the dosages. I would take the high alert medications into the med room and dispose of these with a second nurse, as well as document everything.